both nationally and internationally. Please join me in welcoming Dr. Arun Sundaram onto the stage.
Good morning, everyone. I'm incredibly honored and humbled at the excellent video, first of all, and thank you, Mr. Sivasankaran sir and IO for this opportunity for me to be here. I'm here to talk about a couple of things. The first thing is I have a conflict of interest. As was mentioned, right? I treat complex blockages in Chennai and pretty much in a lot of places around the world. But today's talk is not about treatment. I mean, we'll touch upon that a little bit. It's really about how do you prevent this. And I think every word that has been spoken thus far, I can tell you, if you follow all this, you will greatly reduce the chance of getting into problems in the first place. So I'm going to switch gears a little bit and talk about a few basic things. Heart disease, what do we mean by this, right? For a heart attack, na enna? Because a lot of people there are certain myths which is like, okay, cardiac arrest aiduchu, heart attack na enna, small heart attack, periya heart attack, adhu idhu sollitam. So let's just get down to the basics. When you look at heart disease, it's any disease that involves the heart pretty much comes under heart disease. So the most common kind of heart disease that we see, and the number one killer of people, men, women in India and abroad, essentially is coronary artery disease. Adu enna paakalam. Of course, you can have rhythm problems. There are certain congenital cardiac disorders. Heart failure is when the heart doesn't pump very well. And cardiac arrest basically is when your heart has just stopped working for whatever reason. Now, the elephant in the room, it's coronary artery disease. So here, there is plaque buildup, blockages that form in the blood vessel supply to the heart. Every organ in the body needs blood, and that's how it gets oxygen, including the heart itself. And the thing about the heart is that as soon as the blood leaves the heart, it kind of takes care of itself first. Now, when you have blockages there, that is a problem. This is coronary artery disease. So when you have blockages that prevent blood from going downstream in the vessels, it can cause symptoms. Many times you'll hear people saying, when I walk, I'm short of breath, I'm fatigued, I have exertional chest discomfort. Not everyone has classic crushing chest pain like you see in a movie and falling down. For a lot of people, this is a very slow, insidious onset. So they'll just be like, okay, I was able to climb up 2 flights of stairs before, but now I can't because I'm just getting tired, etc., etc. So these could be early on symptoms of coronary artery disease. A ventricular tachycardia or when ventricular fibrillation, your heart is pumping very ineffectively. And this essentially is incompatible with life. So within 5-6 minutes, if you're not pumping blood, the brain, you're basically dead at that point. And we see this, right? India, like young people, heart disease, and there's all this question: is it because of COVID vaccine? Is it because there's some conspiracy going on, and there's something in the water? What is going on? And it's very scary, especially like in my news every third day we keep seeing this. Now, there are multiple reasons. We'll kind of do a little bit of a deep dive on why we have a lot of heart disease in our country especially, and anywhere from 2 to 4 times more likely to develop CAD. Typically, almost a decade before onset of heart disease, symptomatic heart disease, Indian population compared to the Western population. And when you have disease, it typically tends to be more severe. In fact, Dr. Raman talked about diabetes and some fantastic points that he made. So unfortunately, diabetes is coronary artery disease or twin mari vechukongala. They kind of go hand in hand, and we also have a lot of diabetes. So many times the vessels that we have in our diffuse disease and genetic like SNPs, etc., single nucleotide polymorphisms that are more prevalent in the South Asian population, that does put you at a higher risk. So general cardiologist general doctor they'll always ask you, do you have a family history of heart disease? Have they had heart attacks before the age of 40 or 50, depending on the gender, bypass or whatever, because it tends to run in families. Okay, so just to summarize, skinny fat, insulin resistance, atherogenic dyslipidemia, and high LP small a. So idellame bad news, right? I mean, it's all doom and gloom. It's just saying that life is all bad for South Asians. That's not the thing, right? So what can we do about it really is what this is about. So number one, and again, very, very basic stuff. We tend to be very, very high on refined carbs in our diet. Usually, right? I would say try and shift the plate. Get almost half of it should be good, healthy vegetables, enough protein, as was just discussed. In fact, start with the protein. and have good starchy vegetables. Definitely eliminate things like vanaspati. Use good oil, especially olive oil. And again, good diets that have shown to decrease mortality include Mediterranean diet and DASH diet. Sugar is a big bad thing. If you can avoid it, more power to you. Try to go with minimally processed whole foods and plant-based. Again, that's just to summarize that. Most of the plate எடுத்துக்கிட்டிங்கன்னா அதில் ரைஸ் இருக்கக்கூடாது, வெஜிடபிள்ஸ் இருக்கணும். And not fried vegetables. Potato கூட எனக்கு பிடிக்கும், so I'll have French fries-ங்கிறது is not really a vegetable. The other thing, ensure that you stay physically fit, right? A lot of people, and I think this is kind of changing, but many times women especially, and women also do get heart disease, by the way. Breaking news, it's the number one cause of mortality in women too, is heart disease. Weight training is extremely important. And the more muscle you have, think of it as something that can absorb your glucose. So, glucose sponge mari vechkonga. At least get 2 or 3 sessions per week. Sleep, could not emphasize enough. If you don't sleep enough, you make bad decisions with your food. Sleep is our superpower. Please ensure that you get to bed early, wake up early, try and get at least 7 hours. Easier said than done. I myself, this is one of the big challenges, especially with travel and jet lag, but you should really try to prioritize sleep. The other thing, of course, talk to anybody and everybody. We all have stressful lives, right? We have to learn techniques as to how to handle stress. It's easy for me to come and say, okay, stress up, but you have to work on it, just like anything else in life, right? For your jobs, we got certain skill sets. Ade madri stress ko, what do? Learn breathing exercises. There are some wonderful techniques, but put in some time and effort. It's totally worth it. Again, they've talked about a lot of the supplements, and there is a general perception in our country, like supplements la edukku enna edentana. I've now practiced predominantly in India for almost 7 years. I can say almost everyone is vitamin D deficient. B12, especially vegetarians, is very low in a lot of people. We have talked about omega-3 already enough, CoQ10. So there are at least some supplements that I would say are practically mandatory in our part of the world. But of course, it always is optimal to work with your healthcare provider and get a tailored thing for what all you need. Guys, can we go? Okay, there we go. Okay. The other thing is, at least once in a lifetime, get a proper lipid panel done, HbA1c, and of course there are newer tests. You could do fasting insulin, HOMA-IR, and a whole lot of tests. I'm not getting into all the testing right now in the interest of time. You should know your blood pressure, HSCRP perhaps, and for those, in case you're like worried about, do I have heart disease, etc., a coronary artery calcium basically tells you if there's any calcium in the coronary vessels. And nama body everything calcifies. Like eventually, as we get older, we essentially petrify. So calcium is kind of the end stage of atherosclerosis, and sometimes even a CT-CAG might be indicated. Point enna, be proactive, get informed, take ownership, figure out what you need for your body, discuss with your primary doctor, and then go from there. More knowledge, you're going to make better decisions. Now, here's the other thing. Many times, we all want quick fixes, right? Now, bypass pantana, it's all cured, stent vechitana, it's all done, etc., etc. So there is a role, essentially bypass. So if you have a very tight blockage, instead of blood going through that, they basically it's like putting a bypass road. Stents na idukra road nama open pandrathu. So if you want to take control how you live, your stress, your diet, your sleep, your supplements, your being involved, your regular checkups, that's your healthy lifestyle. That's like driving safely. Drive panambodhu we tell people like don't text and drive, don't drink and drive, and the madri da. One life, one body is one car. And again, this earlier on I said what it meant to be metabolically unhealthy. If you fail any of this, you're metabolically unhealthy. And again, this also would change with time. So to summarize, right, redefine your lifestyle, supplement when you need to strategically, proactively screen. And again, I think you should also share knowledge, because there is a lot of myths out there about health. So if you don't know what it is, it's a new symptom that's lasting for a couple of minutes. Please take an aspirin, high-dose statin. Don't say like I'm going to walk it off, etc. Get to the nearest ER or the hospital. If you can get an ambulance, great. If not, have a friend or a loved one drive you there, because you don't want to ignore symptoms and later find out, or worst case, have a major cardiac event and not make it. The other thing that I do want to tell you is, like we've already talked about it, many times, when it comes to blockages, etc., we have all talked about prevention, but sometimes, unfortunately, people still get disease. It's like saying, I'll drive safely. Can you still have an accident? Yeah, you can. So my key important thing is, any blockage actually can be done in any way, right? You could bypass it, you could stent it, etc. I mean, therapy for a patient should be based on what the patient needs and not my ability to open up a blockage or not. So get an opinion, if need be, from a second competent cardiologist. Thank you.